Assalamu alaikum warahmatullahi wabarakatuh, and welcome to the world of knowledge with Hisham. And today we are going to discuss about our previous topic. We are just going to continue to our next topic. So let's get to the video. Addictive drugs are the drugs that, when absorbed into the body, makes a person dependent on them. Not on the first time, it may take a few days, but the person cannot function well without it. So without it, the person may not be able to do some things which he was able to do before he got addicted to them. So in this video, we will discuss about the types of addictive drugs and as well as antibiotics and vaccines. So let's get on with it. Narcotics are those types of addictive drugs which can also be used as a pharmaceutical drug. Well, there are actually some drugs that can be used as a pharmaceutical drug. That includes morphine, which comes from this plant over here. This plant is called the opium poppy plant. This is morphine over here, the white colored juice that is coming. So there is a semi-synthetic drug called heroin. We know it as a very dangerous drug, addictive drug that is commonly used by narcotic abusers. Well, that actually is a semi-synthetic drug from morphine. So they extract morphine and they extract heroin from morphine. Morphine is used for pain relieving with the patients suffering from cancer or they are used after operation, because after operation there is very much pain, for treating acute pains. But it also has a high tendency for addiction. So my friends, codeine over here is also a narcotic. It is also used for the same reasons as morphine over in the previous clip. So these both are same, but they are in conjunction with Panadol, etc. Sedative drugs are also a type of addictive drug that are both pharmaceutical and addictive. So wait, in the previous video I discussed about sedatives. Sedatives are actually those medicines that, when absorbed into the body, they reduce irritability and excitement and induce sedation. Now these drugs, if consumed in high amount, not in low amount but in high amount, if consumed in high amount, can induce suicidal thoughts in the brain. Yes, it works on the central nervous system, so be aware. Hallucinogens, yes, hallucinogens, they are not pharmaceutical. Thank God. These are super illegal and are very dangerous also. They work by entering into the central nervous system and induce and may change thought, emotion, perception. They're pretty harmful. And as you see, this picture over here, this is a very important kind of hallucinogen. This is called marijuana drug. There are also many kinds of other hallucinogens which comes from cactus and a mushroom. The drug that comes from the mushroom is called psilocin, and the one that comes from the cactus is called mescaline. Not mescaline, mescaline. These drugs are also hallucinogens, as I said before. So marijuana and hashish, also hashish, that brown thing. These are smoked. Point number one. These are smoked. Point number two, and is actually obtained from the dried flowers of cannabis. What is cannabis? Cannabis, my viewers, is actually a plant. From this plant, the leaves are taken out and is smoked or either dried up, and they are just rolled into a cigarette form of thing and then smoked. But they are very harmful effects. These also can cause many lung diseases like bronchitis, etc. And also has the effects of hallucinogens, as I discussed earlier, that is dilation of pupil, constriction of some arteries, and raising blood pressure, which can also cause an heart attack. So the best thing to keep in your mind is to keep away from these things. Antibiotics. Antibiotics are drugs that are used to treat bacterial infections. There can be many types of bacterial infections, but the antibiotics are just simply divided into two. This first type of antibiotic is bactericidal, meaning that they kill bacteria. Yes, you've guessed it correctly. It's an army of medicine trying to kill the disease inside. And the second type is bacteriostatic, meaning that they defend the organs or the parts from the bacterial infections. And they also stop they inhibit or stop the folic acid synthesis inside the bacteria, or can do other things to stop them. Cephalosporins come in the category of bactericidal, meaning that they kill bacteria. There are also many types of bactericidal, but we are going to just discuss these. Now the second one is tetracyclines. These are bacteriostatic. They only stop the functioning of the bacteria inside our body. Now they stop the infections. So how do they stop it? Warning. Tetracyclines should be only used for children above the age of 12 or 13, and should not be used for the children with milk teeth, because they can be prove very harmful for them. Because there are certain rules for the medicine you are eating, so the doctor knows it better. Sulfa drugs. These drugs contain sulfonamide group. So these and are also bacteriostatic. One more bacteriostatic in our group. These inhibit the folic acid synthesis in bacteria and stops them from doing their functions. But antibiotics do cure, but if you take them properly. So the next coming topic is antibiotic resistance. How does bacteria in your body gain resistance? There are actually 4 points that I'm going to describe as shown over here. Number one, some bacteria acquire resistance against your antibiotic. The reasons may be because you're not taking it at the prescribed time, or the doctor prescribed to eat you for 5 days and you just eat for 3 days, and that can be the reason for the antibiotic resistance. Point number two, antibiotics kill bacteria. That is a fact, but not those resistant to bacteria. And the resistant bacteria can also gain benefit from those antibiotics, I think. Point number three, resistant bacteria also multiply and can also send its resistant gene on other bacteria as well. So if there's one antibiotic resistant bacteria in your body, it can go to other bacteria as well and can spread the disease instead of curing it. And then last but not the least, point number 4. To prevent antibiotic resistance, take your drugs at time, not the addicted the pumpkin. As you take your antibiotics in time, this will cause even the resistant bacteria to die. That can happen if you are prescribed. But what happens when it gets worse? Doctors will prescribe you with much heavier doses. If you are eating a half a tablet, he will say simply to increase it up to 1. So, higher dosage. Do not eat your antibiotic if it is not subscribed. Not eat the antibiotic which not has been prescribed to you. For example, I am a boy standing with some infection and I think the same infection is to the other guy and he has some antibiotic and I borrow some from him and eat it. Actually, that can prove harmful. So do go to the doctors for this. Only they can prescribe you with the perfect antibiotic they need. The word vaccine is now known to every single body because we think it as a immunity to some diseases. So nowadays, COVID-19. So what is a vaccine actually? Vaccine is a weakened pathogen of the same disease you want to prove immunity with. How was the first vaccine invented and when was it invented and what happens when it gets into our body? What is the secret about vaccine? So the word vaccine. Okay. 1796 British physician Edward Jenner. Edward Jenner took a boy and injected him with a cowpox injection. When the kid got cowpox, simply after recovering it, he just took another injection which had pus cells from smallpox and injected the boy with it. And as if you remember, smallpox was a very dangerous disease in the early ages. It was very contagious. Now the boy was injected with smallpox. The boy did not get smallpox. Oh my God, what a miracle! The boy gained immunity because he was injected with cowpox, the word pox. Now this made Edward Jenner more excited. Oh, okay, resistance. That's nice. And he did more experiments to more people. So vaccine is actually a weakened or dead pathogenic material of the same disease you're trying to gain immunity to. Now, let's get to what happens when the vaccine is injected into your body. Pause करते हैं.
नहीं
आप करते हैं. So vaccine, when it enters into your body, as I said earlier, they are weakened or dead pathogenic material. So when they enter the body, our WBCs, aka our soldiers, they